Hi, good morning, everybody. It is Dr. Rosenfield here at the Pearl Women's Center, and it's March 1st, which means it is now officially Endometriosis Awareness Month. Endometriosis is a condition that is very dear to me and to my practice at Pearl Women's Center because it affects so many of our patients. At least 1 in 10 women are impacted by endometriosis, and this is a condition that can lead to chronic pelvic pain. It can lead to dysmenorrhea, which is painful periods, and it also can lead to infertility, which is a condition where women are having trouble getting pregnant, potentially due to this disease process. Now, we can get into a lot of detail about endometriosis, but I think the overriding understanding needs to be that this is a genetically driven condition. It does seem to run in families. It doesn't always manifest itself the same way. Some patients have very severe disease and other patients have very mild disease. And sometimes it can be very difficult to predict what type of disease process each patient's going to have. So we typically start out our evaluation with a careful interview, talking about your history, trying to figure out exactly when, how, and where the pain, if it is a painful situation, manifests itself, or getting a careful history looking at things like infertility and the various components that may contribute to one's difficulty trying to get pregnant. While we think that endometriosis is largely a disease process that begins in the embryologic phase of development of a human, meaning that as cells migrate to various parts of the developing embryo, that's when endometriosis is probably determined, and perhaps even more so by the DNA and genetics of a particular patient. We also recognize that all patients are not the same, and endometriosis may not manifest itself in one patient the way it does in another. What we know with near certainty is that the best treatment strategy for endometriosis is going to be surgically to excise or remove the disease process. Now, for some patients that may seem a bit aggressive, and for those patients that can be managed on medication, that's a reasonable opportunity to provide management. Again, we start with an exam. We then move forward to data collection, which is going to be with imaging and a physical exam. And then we work with you to determine what the proper next step is. That next step might be laparoscopy, where we take a look, basically making a very small incision inside the belly button, and we pass a laparoscope through that incision into the pelvis to look for endometriosis. The thing about endometriosis is it doesn't always reveal itself on imaging, and that's why sometimes a surgical intervention is required. We are more than happy to entertain questions. You can always contact us at info@Pearl Women's Center. We're also doing telehealth visits, and we would be more than happy to see you in person. We are really pleased to be able to participate in a program like Endometriosis Awareness Month to help educate our patients about the various techniques for treating and for diagnosing this extremely prevalent problem. So again, thank you for your time. Please don't hesitate to reach out to us if you have any questions about endometriosis and if you feel that perhaps you might be impacted by this process. Again, thank you.